I'm Dr. William Grobman, a maternal fetal medicine physician and a professor in the Department of Obstetrics and Gynecology at Northwestern University. And I just wanted to talk a little bit about the EPPPIC project, which I'm involved in as one of the trialists, and I'm also on the secretariat. I think this is such an important project and incredibly valuable in terms of thinking about the health of women and children as we move ahead. As you probably know, preterm birth is an enormous problem in the U.S. and in the world at large. It's responsible for an enormous amount of morbidity and mortality for children, both acutely when they're born, and there's evidence that the morbidity can continue throughout the course of their entire life. And any effort to reduce the chance of preterm birth is an enormously valuable one. The EPPPIC project is designed to better assess whether progestogens for a variety of circumstances can reduce the chance of preterm birth. This is an incredibly important question, both as a clinician and as a researcher. As a clinician, every day we're confronted with women who are at risk of preterm birth, and we have so few tools to try to reduce that risk. As a researcher, we've looked into many different reasons and techniques to reduce preterm birth with few showing promise. Progestogens have been one tool, one therapeutic modality that have provided some evidence, although sometimes inconsistent, that preterm birth can be reduced when they're used for the appropriate indications. But because the evidence has been inconsistent, it presents a problem, both as a clinician who's trying to apply that evidence and as a researcher who wants to understand best how to take the evidence that exists and use it for future studies and investigation. The EPPPIC project is going to bring together all the RCTs, that's randomized controlled trials, that have been done so far, and allow the data from these trials to be combined and synthesized so that it gives us a much better understanding, not only if progestogens work to reduce the chance of preterm birth, but who they're most effective for, and whether a certain type of progestogen is more efficacious than another. Another reason that the EPPPIC study is so important is that it's being done in a highly rigorous fashion, which really promises to give us the best insight that's possible. Most notably, this study is being conducted by a research group that is independent of any investigators who have contributed previously to information through trials. Many of those investigators are involved in the EPPPIC study by their presence on the secretariat, which has been able to allow them to provide insight into the protocol and the types of analyses that are going to be most clinically valuable. But they won't be taking primarily part in the analysis, and that analysis, as I mentioned, will be completed by an independent group that then will present the findings and allow further interpretation. This kind of arm's length relationship between people like myself who perform the trials and people who are doing the analysis really promises to be the best chance to give us information that is objective and unbiased. And I think really is another reason that this is such an important project and one that I'm so excited to be a part of.